Why is inflammatory bowel disease a colorectal cancer risk? Have you ever wondered how inflammatory bowel disease, or IBD, can increase the risk of colorectal cancer? Understanding this connection is crucial for anyone affected by IBD, which includes conditions like Crohn's disease and ulcerative colitis. The primary reason IBD raises colorectal cancer risk is due to chronic inflammation in the colon. This ongoing inflammation leads to changes at the cellular level that can promote cancer development. One of the key factors is chronic inflammation and DNA damage. When the colon experiences long-term inflammation, it undergoes continuous cycles of injury and repair. This process generates oxidative stress, which can damage the DNA in the cells lining the colon. Over time, this damage can activate oncogenes, which are genes that promote tumor growth, and inactivate tumor suppressor genes that normally prevent cancer. This accumulation of mutations increases the risk of cancer. Another important aspect is field cancerization. Unlike sporadic colorectal cancers that often arise from isolated polyps, cancers associated with IBD can develop in large areas of inflamed colon tissue. This means that multiple regions of the colon can be at risk simultaneously, rather than just one single lesion. Dysplasia also plays a significant role as a precursor to cancer. Chronic inflammation can lead to dysplasia, which is an abnormal but non-cancerous change in the cells of the colon lining. Dysplasia is a major risk factor for colorectal cancer in patients with IBD. It can vary from low grade to high grade, with higher grades indicating a greater risk of progression to cancer. Interestingly, cancer can sometimes develop even from low-grade dysplasia in IBD. The immune system and gut microbiota also contribute to cancer development. The interaction between immune cells, the gut microbiome, and colon epithelial cells can create an environment that fosters cancer. Dysbiosis, or an imbalance in gut bacteria, along with immune dysregulation, can promote this carcinogenic environment. Additionally, the duration and extent of inflammation are crucial factors. The longer a person has IBD and the more extensive the colon involvement, the higher the risk of colorectal cancer. For instance, patients with extensive ulcerative colitis face a greater risk compared to those with inflammation limited to the rectum. It is also important to note that IBD-associated colorectal cancer follows a different pathway than sporadic colorectal cancer. While both involve genetic mutations, the inflammation-driven pathway in IBD includes unique molecular and immunological changes. To protect colon health and reduce cancer risk, there are practical steps that can be taken. Regular surveillance through colonoscopy is essential for patients with IBD to detect dysplasia or early cancer. Early detection allows for the removal of precancerous lesions, which can significantly lower the need for more invasive treatments. Controlling inflammation is another vital strategy. Effective management of IBD through medications can help limit chronic inflammation and, in turn, reduce cancer risk. Personalized risk assessment is also important. Factors such as disease duration, extent of inflammation, family history, and presence of dysplasia can guide individualized screening and treatment strategies. In summary, the increased risk of colorectal cancer in individuals with IBD is primarily driven by chronic inflammation, leading to genetic changes and widespread abnormalities in the colon. Managing inflammation and maintaining vigilant surveillance are essential strategies to mitigate this risk and protect colon health. Always consult healthcare professionals for personalized advice and strategies tailored to your specific situation.